Meeting call to order.
Thank you, President. I request President Rotarian PHF Pritika Gupta to confirm the minutes of the previous meeting.
The minutes of the previous meeting were circulated on our group for everyone's reference, and I believe everyone has gone through the same. Thereby, the minutes of the previous meeting stand confirmed. Also, I would like to take a moment to express our deepest condolences for the sad and unfortunate demise of the father of our secretary, Rotarian Ruby Agarwal. The sad demise happened on 11th of May, and we as a club, Rotary Club of Organ Donation International, stand with her in this hard times of grief, and really express our gratitude to her for being able to attend the meeting even during such hard times. Over to you, Secretary Ruby Agarwal.
Thank you for your kind words, and thank you for the condolences from all the members. And moving forward, our topic for today is a talk on organ donation warriors by Rotarian Lal Goel, Chairman, Organ Donation India Foundation and GYAN, and founder and charter president of Rotary Club of Organ Donation International. This is a new concept that we have introduced for creating warriors across the globe. And I request our founder and charter president, Rotarian Lal Goel, to throw light on this.
Thank you, Inspire Secretary and Inspire President. I also extend my deepest condolences. And yes, today's topic is organ donation warrior, and I can say our Inspire Secretary has shown the warriorness, and that's why she is attending the meeting even after after the 6th day of the demise of her beloved father. I want to begin with the timeless words of former US President John F. Kennedy. Ask not what your country can do for you. Ask what you can do for your country. Friends, these words are deeply relevant to the mission of organ donation. Because today our country, am I visible or not?
Yes, sir.
Yes, visible.
Yes, sir, visible, sir.
I thought that I'm not visible. Okay, no issues. Because today our country does not merely need spectators. It needs citizens who are willing to step forward, create awareness, inspire hope, and save lives. And that is exactly why Organ Donation Warriors was created. Today I wish to speak about a movement that has the power to transform India's future, Organ Donation Warriors. Friends, every day in India, thousands of patients wait desperately for an organ transplant. A mother waits for a liver, a young student waits for a kidney, a child waits for a heart. For many of them, time runs out. Not because medical sciences has many of them, because medical science has failed, but because an organ donor could not be found in time. This is one of the greatest humanitarian challenges faces our country today. India has world-class doctors, advanced transplant hospitals, and extraordinary medical talent. Yet our organ donation rate remains critically low compared to many countries around the world. Why? The answer is not a lack of technology. The answer is a lack of awareness. Myths, fears, misinformation, hesitation, and social taboos continues to prevent families from saying yes to organ donation. And this is exactly why Organ Donation Warrior was created. This movement is not merely a campaign. It is a national people's movement, a citizen-led revolution of compassion. an initiative by the Organ Donation India Foundation in association with the Rotary Club of Organ Donation International and Global TV to build India's largest volunteer network dedicated to organ donation awareness and advocacy. Friends, throughout history, every great social change began with ordinary people deciding they would no longer remain silent. Organ donation warriors believes that every citizen can become an ambassador of life. You do not need to be a doctor. You do not need political power. You do not need wealth. All you need is compassion and the willingness to speak to another human being. One conversation can save a life. One pledge can save multiple lives. One warrior can inspire thousands. That is the philosophy behind this movement. Our vision is simple but powerful: to build a compassionate, one moment, please. Sometimes technology gives hitches to me and I have to. Our vision is simple but powerful: to build a compassionate and informed India where organ donation becomes a social responsibility and a national culture. Our mission is to train and empower volunteers across every district of India to spread awareness, encourage organ donor pledges, and inspire communities to embrace organ donation. Friends, one of the most beautiful aspects of this movement is that it is open to everyone aged 18 or older. We welcome organ donors, transplant recipients, donor families, social workers, students, teachers, healthcare professionals, Rotary and Lions members, media professionals, influencers, and every citizen who wants to make a difference. Most importantly, this is a completely free program. Mind it, completely free program. No registration fee, no charges, no financial barriers, because saving lives should never be restricted by money. Every registered organ donation warrior receives free online training designed to build awareness, confidence, and leadership. The training includes understanding organ donation, brain death awareness, legal and ethical aspects, public speaking and communication, social media advocacy, community outreach, leadership development. Friends, awareness alone is not enough. Awareness must become action. That is why organ donation warriors will organize awareness drives, social media campaigns, school and college programs, public seminars, walkathons, candlelight tributes, human chains, community outreach initiatives across India. And through global TV and other media platforms, our message will reach millions of people. At this moment, I am reminded of the inspiring words of Mahatma Gandhi. The best way to find yourself is to lose yourself in the service of others. Friends, organ donation represents one of the purest forms of service to humanity. When a person donates organ after death, they do not die completely. A part of them continue to live. Their eyes continue to see, their heart continues to beat, their kidneys continue to give life, their liver continues to protect another family. Few acts in life are greater than giving life to another human being. Friends, Rotary has always believed in service above self. And I truly believe that organ donation represents one of the highest expressions of that ideal. That is why the Rotary Club of Organ Donation International was created. Perhaps one of the very few Rotary clubs in the world dedicated entirely to organ donation awareness. And today, through Organ Donation Warriors, we are taking this mission to every corner of India. Mind it, we are taking this to every corner of India. But let us be honest. Government efforts alone are not enough. Hospital alone cannot solve this crisis. NGOs alone cannot solve it. The media alone cannot solve it. This challenge requires a people's movement, a citizen-led movement, a movement where every Indian becomes part of the solution. And here I would like to quote Margaret Mead. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has. Friends, this is exactly what Organ Donation Warriors seeks to achieve. We need organ donation warriors in every city, every district, every school, colleges, housing societies, workplaces, community, and religious institutions. Imagine the power of 1 lakh trained organ donation warriors across India. Imagine the impact if every warrior inspires just 10 people. Imagine the number of lives that can be saved. Friends, this movement is not about publicity. It is about humanity, not about recognition, but about responsibility. Not about one organization, but about a national mission. Today, I appeal to every person listening or watching today's meeting. Please take the organ donation pledge. Speak to your family. Educate your children. Discuss organ donation openly. Remove fear and misconceptions and become part of this movement. Because awareness delayed is life denied. Before I conclude, I wish to express my heartfelt gratitude to all of you who have joined today's meeting or who are watching this live telecast on Global TV and Gyan and other media live, or who are going to listen or watch this afterwards, as well as to Organ Donation India Foundation, Rotary Club of Organ Donation International, Global TV, all the donors, their families, doctors and healthcare professionals, transplant recipients, media partners. You are not merely volunteers. You are messengers of hope. You are the guardians of humanity. You are lifesavers. Let us work together to build an India where no patient dies waiting for an organ. Let us create a culture where organ donation becomes a national movement of compassion. And let us always remember, one organ donor can save multiple lives. One warrior can inspire thousands. I would like to conclude with the immortal words of the great poet Robert Frost. The woods are lovely, dark and deep, but I have promises to keep and miles to go before I sleep and miles to go before I sleep. Friends, our journey towards creating a truly organ donation aware India has only just begun. We still have millions of minds to change, thousands of lives to save, and countless families to support. Together, let us continue this mission with dedication, compassion, and unwavering commitment. Thank you very much. Jai Hind.
Thank you so much, Rotarian Lal Goyal, for this tremendous and very, very inspiring warrior movement, where we will be able to spread the mission and motto of our club of spreading awareness many, many folds. If any member has any queries, I think our founder and charter president will be very happy to answer all the questions. So anybody who wants to ask can unmute and ask the questions.
Yeah, I can see Rotarian Ramnath Pradeep.
Sir, congratulations to you. A wonderful speech, wonderful idea which is coming. I hope that this should get realized, because in the Rotary Club, I mean international, we have started many of the things like Rotary has itself program for the school children, program for college students, and creating the some of the area which you have done a lot of things in particularly in opening some of the the Rotary foundations, other things. But what has happened is we did not get a support from 3141. Ultimately, the club which has opened, the Rotaract club which we have opened, was ordered to be closed down. So my suggestion to you would be that you please circulate this to the, also take the permission or take the inform to the 3141 that this is what we are going to do it, so that tomorrow, because you got a very good friends within the club, outside club, and you got also a lot of other people also. So you kindly, my suggestion is to inform them that we have formed this. The motto of this is this. Whether it is within the purview of the our club, the association rules and regulations.
Okay. Very good suggestion and very good caution you have given. I would like to say that if you see to it, I have sent you the concept paper of this also, where we have taken, because what we have suffered earlier and for last 2.5 years when we have formed the Rotary Club of Organ Donation International, we were facing lots of problems bureaucratically, as you rightly said. And to overcome that, if you see the structure of this particular scheme and under which we have taken to overpass all the things, I would not like to put everything on record here, but definitely I would like to tell you when we will discuss in person or on phone. I will explain to you. I think this will overpass what we had a past experience. This will not have any hurdles from anyone. And I would like to inform all of you that we are finalizing to officially launch this, because now already the soft launch, you can say, we have just sent the forms, etc. And I am very happy to inform you that hundreds of forms have already been received by us from across, not only I will say India, across the world. People are even joining from outside India also. And people are taking very much interest. Two reasons which I can say very proudly. First reason is this subject or this topic or this cause is very noble cause. Second is it is totally free. There is no charges to train someone, because in last 2.5 years, many of our members have already trained to train the trainers. So we will be able to train them. And once we will be able to train them properly, they will be getting the advantage. How they will get the advantage? Again, I will give just a bit idea that once a person who join us as an organ donation warrior, he or she will come to know about organ donation once he or she will attend the sessions which we are giving free of charge. And when it is on Zoom, definitely he or she will be attending at home or workplace. So it means those who are surrounding him or her will also come to know about organ donation. So the purpose is not only to create awareness at one person, it will give awareness to many persons. So that is why we are doing it. And once we are launching in the first week of July, that is the regal year, because this year of Rotary is now going to end. We have already asked the district governor of 3141, the regal district governor, to be the guest on that day. We are also looking for some dignities like the former West Bengal governor or the present Andhra governor, whosoever will be available, or some other dignity. Even we have approached to the Chief Minister of Maharashtra. If they will give time, then, but it will be definitely online, so that everywhere, anyone, whosoever will be our warrior, they will be joining us and they will get the advantage of it. So I think your reservations are well taken care of, but still, I would like to discuss in person when we will meet. Thank you very much.
I like to discuss in person because
Yeah,
I feel
yes, I will.
it's a good
I will
idea, no
definitely.
doubt about it. There
I
are
will.
its and buts.
Yes, I will
Charge
discuss.
which needs to be taken because
Yes, definitely. We will
the
discuss.
name carrying itself is very important.
Yes,
It can
definitely.
also
Yes,
good or
Dr.
bad
Vijay
both.
Singh, yes, you want to ask? Yes.
The forms are not opening, sir.
There was a problem which we have received. So if you see, we have again send you on a words form again. Again, you see, otherwise we will send you again on the word form. If anybody is having problem, because few of the members got, or the others who have received, they have typed on that, but now we have sent the PDF and we are trying to work out on the Google form very soon. So once it will be there, definitely we'll see initial teething problem. That's why this 2 months time or 1.5 months are going to be we are creating the infrastructure all over across the India, so that there should not be a problem when we will have the official launch in month of July. Yes, please. Whosoever wants to ask any doubts, anything, whether you are our member or you are a warrior, because I can see few of the warriors are already there, they can also ask the question. I would like to clarify whatsoever I can clarify now. And I will further tell you a few things. With my experience for last 10 years, and especially the 2.5 years of my experience with Rotary Club of Organ Donation International, I found that until unless we will not reach to everyone. Today, what we are doing, we are taking a meeting or conducting a meeting where 100 people or 200 people or 500 people are there, or say 5,000 people are there, but we are not reaching to the grassroots. Here, what structure we are developing is that we are starting from the top. We will have a national committee under which we will have state committees. Then we have district committees. We are going to involve, because the thing which I realized is the language barrier. Okay, I can speak in Hindi, English. Many of our members understand English very fluently. They can't speak in Hindi because they are from South or they are from abroad. But there are few members who are from North India. They are not understanding Hindi. Now, this is the position that they are not understanding English. Now, when this is the situation, if we will like to impose ourselves everywhere, is not possible. To overcome that, we will have the local or leaders whom we are involving. Leaders doesn't mean the political leader. Leader means the leadership among the organ donation warriors, who are going to train in the local language, the regional language, which is required. So we are creating that infrastructure. Unfortunately, because our Inspire secretaries things happened, her father demise, we have got a setback. But with her spirit, again, we are on the track, and I am sure that in the first week we will be launching it. Secondly, I realized, please unmute and raise your hand whenever you are ready to ask the question. Otherwise, I will be explaining more and more things. Secondly, the things which we are going to do it, they are real testimonies of the organ donors and the agony and pain suffered by the recipient. I have seen personally when we conducted our meetings, when we took the North India tour with myself and our 2 members, organ donor and organ recipient in North India, even at Aligarh Muslim University, I found that when they started speaking, the tears. And that is what is the the need of the hour. That is what the need of the hour. So what we will do in this program, we will involve the organ donors, the organ recipients. So they will give their testimonies. They will speak what they have faced, how the critical conditions are, because the pain which they have faced, which they have suffered, cannot be explained by a person who has not suffered that pain. The happiness or the sad moment of a donor family which they suffered at that time, it is very easy to talk, it is very easy to speak, but it is very, very difficult when the traumatic condition of a person, when the person is declared brain death, and at that time to ask to counsel the family to donate organs. And that is only possible if this movement takes place, if the counselors have been developed from a lay person, not from those who are, because my recent meeting in the Soto, Jaipur, they explained to me that when we convince the patient to donate organs, the families, the burden comes, the barrier comes from the ward boy, from the nurses, from the chaiwala, and all the rickshawala. Now it means we have to enlighten them. हमें उनको भी जागृत करना है, हमें उन्हें भी अवेक करना है, हमें उन्हें भी वॉरियर बनाना है. Once they will become the warrior, अगर आज वो लोग भी वॉरियर बन जाएंगे तो आप ये मान के चलिए कि इस देश में एक क्रांति आएगी, एक बहुत ही सार्थक क्रांति आएगी, एक बहुत ही पॉजिटिव मूवमेंट आएगा. क्रांति का मतलब ये नहीं कि हमें सत्ता के खिलाफ कर रहे हैं, हम सत्ता के साथ कर रहे हैं. हमें वो जो मैंने शुरू में कहा, मैं दोबारा रिपीट करूंगा, हमें ये नहीं देखना है कि कंट्री ने हमारे लिए क्या किया, हमें सोचना है हम कंट्री के लिए क्या कर सकते हैं. तो जब हम आगे बढ़ेंगे, हम इस मकसद से आगे बढ़ेंगे. और जो मेरा 2.5 साल का अपना तजुर्बा है, एक्सपीरियंस है विद माय रोटरी क्लब ऑफ ऑर्गन डोनेशन इंटरनेशनल, हमारे मेंबर्स बहुत डेडिकेटेड हैं. their dedication I must appreciate. I have seen so many Rotary clubs, I have attended so many meetings, I have given lectures also in the meetings. Even I was the charter president of Lions Club in way back 1983 of Lions Club Mathura Virat, which I also founded at that time. I have seen the attendance of the clubs were mainly for the fellowship, for enjoying the dinner and the drinks. But here the members are dedicated for a cause. In our Rotary Club of Organ Donation International, our attendance are always very good and people are attending. And that is why I consider all my members as warriors. And when they are warriors, they are ready to now create more and more warriors. और अगर आज पूरे भारत में जो हम एक मिशन लेके चलेंगे, जितने ज्यादा लोगों को ट्रेन करेंगे फ्री ऑफ कॉस्ट, नो चार्जेस एट ऑल, आई एम श्योर कि भारत में जो एक क्रांति आएगी, पॉजिटिव क्रांति आएगी, कि वो टाइम नहीं रहेगा कि भारत रियल में विश्व गुरु बनेगा ऑर्गन डोनेशन के क्षेत्र में, जहां हम गर्व से कह सकेंगे कि हमारा कोई मुकाबला नहीं है. नहीं तो आज हम अमेरिका को देखते हैं, स्पेन को देखते हैं, यूके को देखते हैं, उनकी फिगर्स कोट करते हैं. भारत की फिगर हमें कोट करने में हमें शर्म आती है. लेकिन आई एम श्योर दिस मूवमेंट विद द कोऑपरेशन ऑफ ऑल ऑफ यू कैन बी ए वेरी बिग थिंग. मैं बीच में रोकूंगा क्योंकि उमा जवर जी, रोटेरियन उमा जवर, जो कि एमके इंटरनेशनल आई बैंक चलाती हैं, हमारे क्लब की बड़ी अच्छी सम्मानित सदस्य हैं. और इनका जो आई बैंक है वो पहला आई बैंक है इंदौर का, प्राइवेट आई बैंक, और बहुत ज्यादा एक्टिव हैं, बहुत ज्यादा लोगों को जागृत करती हैं. उमा जवर जी, आप कुछ बोलना चाहते हैं प्लीज.
जी सभी को नमस्ते. जो बहुत ही अच्छा इनिशिएटिवली लेकर चले हैं आज गोयल सर, और बहुत अच्छे तरीके से इन्होंने बताया है कि किस तरीके से हमें आगे बढ़ना है, किस तरीके से हमें अपने वॉरियर्स करना है, बनाना है. और मैं भी खुद वॉरियर बन चुकी हूँ इनके प्रोग्राम की। मैं ये कहना चाहूंगी कि जैसे हम सभी जगह अवेयरनेस क्रिएट कर रहे हैं, बिकॉज फर्स्ट स्टेप ऑफ अवेयरनेस, जब तक अवेयरनेस नहीं आएगा, जब तक जानकारी नहीं होगी लोगों में, लोग नहीं जुड़ेंगे। इसलिए हमें सबसे पहले उनको जानकारी देनी होगी कि हम किस मुहिम से आगे बढ़ रहे हैं। ऑर्गन डोनेशन के लिए क्या समस्याएं आती है लोगों को, उस समस्याओं से कैसे हम छुटकारा पा सकते हैं, जब तक उसकी डेप्थ में नॉलेज नहीं मिलेगा लोगों को, लोग नहीं जुड़ेंगे। जैसे मैंने काफी समय से लोगों को बता रही हूँ कि हम ऑर्गन डोनेशन के लिए काम कर रहे हैं, हम ऑर्गन डोनेशन के लिए मोटिवेट करते हैं, ऑर्गन डोनेशन के लिए बात करते हैं। आज भी हम देखते हैं कि कई ब्रेन डेथ होते हैं बट उनका ऑर्गन डोनेशन नहीं हो पाता है। कई बार काउंसलिंग करने के बावजूद भी उनके पेरेंट्स या उनके जो भी रिलेटिव्स है वो तैयार नहीं होते हैं। क्यों? क्योंकि पता नहीं, उन्हें जानकारी नहीं है कि क्या होता है, कैसे होता है। आज हम बताते हैं कि बहुत सी जानें हम बचा सकते हैं, बट जब तक उनको हम पूरी अच्छे से जानकारी नहीं दे पाएंगे तो वो लोग नहीं समझ पाएंगे। दूसरा, हम सुपर स्पेशलिटी हॉस्पिटल्स में अप्रोच करें, वहां के आईसीयूज इंचार्ज, आईसीयूज डॉक्टर्स और वहां के सभी स्टाफ को ऑर्गन डोनेशन अवेयरनेस का लेक्चर दे, उन्हें समझाए, ताकि वो भी वहां से जब भी ब्रेन डेथ होता है तो वो कॉल करके ब्रेन डेथ के लिए वो बात करे और ऑर्गन डोनेशन के लिए बात करे। दूसरा, आजकल एवरी किटी क्लब में 100 से 150 200 तक महिलाएं हैं और किटी क्लब सबके बहुत अच्छे से चल रहे हैं। तो क्यों ना हम किटी क्लब्स को भी अप्रोच करें, क्योंकि शुरुआत महिलाएं घर चलाती है और कई जगह हमने देखा है कि महिलाएं डिसीजन जो लेती है वही डिसीजन अंतिम डिसीजन होता है। तो किटी क्लब के जो महिलाएं हैं वहां पे उनसे अप्रोच करें, जो भी मेन है उसकी, जिनके यहाँ किटी खुलने वाली है, होटल्स में किटी होती है आजकल, तो हम बहुत आसानी से किटी क्लब में जाके आधे घंटे का समय लेके या 20 मिनट का समय लेके उन्हें ऑर्गन डोनेशन के बारे में बताएं और ऑर्गन डोनेशन की अवेयरनेस भी क्रिएट करें। साथ में हमने अभी अप्रोच किया है शिक्षा मंत्री को, और उन्हें बताया है कि कॉलेजेस के और सीनियर स्कूल्स में एक पार्ट होना चाहिए, एक लेसन होना चाहिए ऑर्गन डोनेशन पे, ताकि आजकल के युवाओं को शुरुआती दौर से ही अगर ऑर्गन डोनेशन के बारे में पता चलेगा तो डेफिनेटली वो आगे जाके स्प्रेड करेंगे और सभी लोगों में बताएंगे ऑर्गन डोनेशन के बारे में। तो एक लेसन ऑर्गन डोनेशन के बारे में होना बहुत जरूरी है, जो कि युवाओं को इसकी हेल्प करेगा और ऑर्गन डोनेशन ज्यादा से
जी।
ज्यादा स्प्रेड होगा।
बहुत बहुत धन्यवाद उमा जवल जी। और आप जुड़ी हैं, आप वॉरियर भी बन चुकी हैं, इट्स अ ग्रेट थिंग एंड आई एम श्योर कि all the members are getting, and those who have not yet got, please be in touch with me. I will send you the form again. Please fill up the form and see to it others also fill up the form, because this is the movement which we all has to take. We were waiting for so many years, and I think in this last 2.5 years of our association, now we have reached to the thing that we must come out with a real very big project. I can see the hand of Rotarian Deepan R. Shah raised. Rotarian Deepan R. Shah, please unmute yourself and just say what you want to say. Rotarian Deepan Shah.
Hello. Yes, hello, Mr. Goel and all fellow Rotarians. It is a wonderful, noble cause. It's a great movement. This really touches me. And one thing what I can say, the biggest challenge what I see here, same thing maybe I feel in India too. If whoever wants committed to become an organ donor or organ and tissue donor should always communicate within their next to kin, within the family members. Maybe this is my wish if something happens, so they don't have to scratch their head and then they don't put their 6 cents within our own decision. So in my case, I always tell, as soon as I register, I tell my wife, my kids, and then my parents was here, my brother, sister, and they did same thing. So this is only recommendation. It's a wonderful movement for India. I'm hoping we get wonderful positive results also.
Okay.
And also, I'm very happy that I'm part of this movement. Thank you so much.
Thank you very much, Rotarian Deepan Shah, for giving your views. And definitely we are incorporating all the suggestions, whatsoever suggestions we are getting, we are going to incorporate, and we will see to it that we will make a movement in such a way that it will go in a long way. And I will tell you, these sessions which we are going to do, I will just give you some about the training thing. We are not only telling them about the organ donation. Organ donation, tissue donation, yes, there will be one session which will be covering the organ and tissue donation. Another will be about legal and ethical things. What is the condition in India? Because people are not aware. They have to understand what is the legal condition, what is the ethical condition, who can donate, who can't donate. Then we will also about the communication. See, public speaking. I've come across with many of the organ donation NGOs and the people. They are very good. They have very good knowledge, but their communication skills are weak. So what we will do a session where a communication skill expert will train them free of charge so that they will know how to speak in the public function. Like I will tell you, today I was invited by Gurudwara here in Mumbai, where this Punjabi cultural group has invited me. They've just wanted to honor me. They have kept a program there for medical checkup. So I told them that, see, look, you are calling me, but it is of no use because it's a medical health checkup. There the lecture is not possible. So why you want? Well, no, we just want to honor you, and we would like to introduce to all our top people here so that tomorrow we want to keep a program. They should know the important. It's quite hot, and the program was in open area. One can imagine the Mumbai is burning right now. But because of organ donation thing, I attended, and I'm so happy to attend the program. So many people met me. The BJP President Mumbai, as well as the Congress Vice President Mahila Mumbai, they both were there. Plus so many who's who of the Sikh community. And I found that they are very eager to know. And when I mentioned about warrior scheme, they were so excited. They says immediately we want to keep a meeting. So my point is we require to train them about this. I will talk further, but I can see the hand of Rotarian Sunil Gupta, who has raised the hand. Yes, Rotarian Sunil Gupta, what you want to say? Please unmute.
Yes, good morning to all. It is a very noble cause and, of course, a great suggestion idea. I have always advocated for organ donation. I'm part of the advocacy group in Northern California. And one of the things I continue to challenge our group and our club is, if our organ donation awareness program only encourages signups, right? But, what's missing is action. But we don't really quite actively connect families to transplant professionals or centers. How effective are we really in increasing successful organ donations? So my question to us as a group is, should this organ donation awareness campaign, being a warrior, also be responsible for building referral pathways? Again, in my past, I've asked questions about centers of excellence and things like that. How about referral pathways to transplant coordinators, counselors, and hospitals, instead of limiting our role just for education and advocacy?
Dr. Sunil Gupta, I think you have joined a bit late today. So you have missed the initial part of my speech, I can say. I have explained that, see, the advantage of this warrior scheme is twofold. First fold is we are talking to each and every person. We are involving, whether it's a rickshawala, whether it's a chaiwala, whether he's a billionaire, millionaire, whosoever he is, whether he's very well educated or not educated. Once this movement takes place, definitely the local, the district level committee of ours, which I have given the structure, will coordinate with the hospitals there, the bureaucrats there, talk to them, say this infrastructure is required. Those who are in a big cities will talk to the hospitals about the facilities, the excellence, as you are talking about the coordinators. So it will go very, very multifold. And as I told you, this warrior scheme is because we are training them free of charge. And it will be on Zoom platform. So what will happen that today, if a person who has signed up as a warrior, if he will take the free session, he or she is joining from either home or from workplace. So from wherever he or she is joining, few more people are definitely going to become aware, which is our purpose. We do not want that only one person should become aware. The shortcomings which I have seen in my lectures, which I was giving for last so many years, is that I can convince one person or say 100% or 1,000%, but I cannot convince thousands and thousands or millions of millions of people. But here, you all will be. So today, as we started our journey, as you know, 2.5 years back, we were 30 charter members of Rotary Club of Organ Donation International. And today, I'm very proud to say on 17th of May, we are 82 members. It's a phenomenal growth because people are going for this cause. You all are joining only for this cause. Similarly, those warriors who are signing up, they want to know. There are many people like today, as I was giving example in the Gurudwara, the ladies coming to see, they were fighting. Why you are not introducing me to Mr. Goyal? They just want to know. We want to talk about organ donation. My husband wants to donate. He's not having knowledge. How to communicate to them? Now to depend only to the government, I think it is unfair. We have to come forward. And I initially quoted the president of USA earlier, John F. Kennedy. I think you missed that quote. Again, I will repeat that quote. Ask not what your country can do for you. Ask what you can do for your country. And that is the phenomenon. One more thing I would like to say, inform all of you that after I released this, I received a message. I will read that message to you. What's the message which I have received from our the charter president of Rotary Club of Organ Donation UK. Now he sent me a message. I will bring out that message. The message which he has sent me after going through my this particular thing, and his message says, where is it? Yeah. And his message, was when he sent on Monday, this Monday only, he sent message, morning Lalji, great to see this, can I get involved in this initiative and create the same in UK? Will need some adaptations, but want to create the same movement. I will be no longer president from July, so want to focus on building satellite clubs in the nations, England, Scotland, Ireland, Wales. Let's meet online when you have some time. Also, are you planning any trips to UK during the next 3 months so we can do a launch of this collaboration? Please advise, regards, Keith. Now, this thing is required everywhere in the world because it is not a problem. Yes, India is suffering because we have very, very lack of awareness, but awareness is required in every country. So this movement, although we are concentrating in India initially, until unless we will not succeed, then definitely this model can be taken even to USA, to UK and other countries because we are not charging anything. We are giving our time, we are giving our energy, we are giving our knowledge, we are giving our experience to those who wants to, really those who wants to know. And once it will reach to the masses, I'm sure that this movement will be a very positive thing and the government will also come forward then and come out with good suggestions so that this movement can go in a big way. That is my answer to you. I'm sure that I could convince you, Rotarian Sunil Gupta. Now I can't see you. I think either a remote or, yeah, you are there. Yeah. Is it okay or you want some further clarification from me?
No, I am with you in terms of the awareness part of it. It's just what I have realized in half of the mystery. I mean, these rickshawalas and chaiwalas, they don't object to people going to the hospital for an ordinary appendix surgery or a gallbladder surgery or any kind of surgery. Why are they so against the kidney transplant or a transplant surgery. So that you can approach from an awareness standpoint. But if the mystery behind a transplant is for at least this group, I have no idea how much of this group knows what happens once somebody agrees to a transplant surgery. What happens next? That mystery, if that gets removed, if we have knowledgeable people in every city that we can connect to, the warrior can truly be like, people come to you for a reason because you're knowledgeable. So just because you can convince somebody to sign up for
No,
an
yes,
organ donation after death.
No, that is what our warriors, we are not asking them to sign up the form now. First, they will be aware. See, it's getting signature will not serve the purpose of this country. The signature is to be done when you are totally aware, number one. Number two, you rightly said about the medical facilities or the knowledge of the doctors. You have seen in the last 2.5 years, the guest speakers which we are bringing to our club are the reputed doctors, the transplant surgeons, the coordinators, or the NGOs head, etc. So that we give the correct knowledge, the proper knowledge to our members. Similarly, the warriors, when we will have the warriors, we are going to give that knowledge to them. That is up to them how much knowledge they want to gain from us. But we will give. But basic knowledge, if they will achieve, then definitely that resistance of chaiwala, rikshawala, or the ward boy or the nurses must go. Once they will go, then definitely the next step will be how to go for the quality thing. That is the next step, which definitely will do. Okay? I'm sure.
Sounds good.
Thank you. Thank you very much. Now I can see the hand of Rotarian Dr. Gada's. Yes. Dr. Neelam Gada, your hand. Yes, please.
Yes, I just wanted to
Can you switch on
share.
the video, please?
I am actually driving, so
Okay, fine. No problem. Please.
So I actually had a suggestion. If we want, because our aim is to reach masses in large numbers, we together, even if we are 1,000, we'll be able to reach to a limited level. Today, social media is something with which we can reach a very large amount of people through small initiatives. If we are going to colleges, we can have reel competition from them, or we can have reels made with celebrities that are attending your club meetings. That can be 30 seconds or 1 minute. Apart from that, if a QR code which can be put up in malls, colleges, or whichever places are accessible to us, we can put up a QR code which gives information which is very crisp, or we can put a QR code for the pledge form.
Dr. Gada, can I just tell you two things? What you have raised. First thing is that what we are doing is we are creating the warriors. Okay, so the information is not going to 1,000 or 100 people. It is going to masses across the India. Number one. Number two, as far as the QR code is concerned, the scams are taking place. The QR code, who is going to monitor that QR code? If you put some in the mall and somebody has changed the QR code, and your personal information is taken. So we cannot take that chance. We are not asking them to go ahead with any of the things which can create a problem for them. We are just asking them to take the proper training, for proper knowledge, or whatsoever the basic knowledge. I am not saying that we are so much expert that we can impart in 5 sessions all the knowledge. But yes, we can give a basic knowledge. And once you will have the basic knowledge, you would like to come forward and you would like to donate, and you would like to pledge to donate. You can convince others also. It has to be a chain reaction. We want to inspire you. We want to inspire everyone. Like you have joined today, you being a Rotary member of Rotary Club of De-Addiction in Mumbai. You wanted to join this meeting because you said that you want to join this movement of a warrior, because you want to do something. So that is what we want. Being in Mumbai, you also have a quest for about organ donation. Think of so many places in India. So many people are not aware. So we will try to reach to everyone. That is our main idea. Okay. I am sure. Yes, sir. And whatsoever further thing you can definitely ask me. I will be able to give more information to you.
Sure. Thank you so much.
Thank you much, Dr. Gada. Yes. Any other things anybody wants to ask? Yeah, I can see Rotarian Ashita Yadav. Yes, Rotarian Ashita Yadav, please switch on.
Good evening, sir.
Good evening. Can you switch on your video or you are also in trouble?
Sir, I'm
Okay,
at
fine.
home,
Go ahead.
but busy. Sir, my suggestion is, as I told you before also, why we don't publish a flex type of thing. We have banners of everything in the market, at the toll plaza, at the roads. Then why we don't have flex of this?
Please mute Dr. Gada. Please see. Yeah, no. Please mute her. Yeah, thank you. Yes, Rotarian Ashita Yadav, everything costs money. Okay, you want to put a holding in on the highway or in a plaza or anything, it costs money, and it's a total free scheme. If you have any good suggestion to get the money without charging anything from the warrior,
No,
most happy.
no. Like, sir, everyone supports so many kind of things, like government officials. They publish a flex of everything, like legit everything. I know, I don't need to explain. You also know and everyone knows. Then why they don't put money in this kind of this cause thing?
Yes, you are right. But the thing is, they are also not aware the seriousness of this particular mission. They are not aware about the seriousness of this particular cause. They think that fine, organ donation, they are not taking it seriously because no one knows the seriousness, as you know, now because you are attending the meetings, you know how serious this cause is. And that's why once the warriors will be there, once it will reach a movement, definitely, as I told earlier also, the government will come, the corporates will come, the big groups will come, they will also join our hands. But till the time, we have to do hard work, we have to give our blood, and we have to see to it that we must train the persons and let the movement will come. And once the movement will come, definitely more and more leaders will be developed. So don't worry, at that time, definitely I will not be there, but many of you will be leading this movement, and where these all things will come. So I'm sure that the time will come, but someone has to start at one place, and that is why we are launching it in January. Let's hope that within first year, as you rightly said, the things will go in such a way that the government will also come forward, the corporates will also come forward, and others will come forward, and they will do these things. So thank you very much. I can see the hand of Lena. I have only 3 minutes left. So yes, rather 2 minutes left. I have another program also. Yes, Lena, Rotarian Lena. Yes.
Good evening, sir, and all the members. Sir, as we know कि हम सब जानते हैं आजकल लोग मल्टी स्टोरी बिल्डिंग्स में रहते हैं, बड़ी बड़ी सोसाइटीज में रहते हैं, और यहाँ पर कम्युनिटी हॉल्स होते हैं, क्लब्स होते हैं। वहाँ एक ऐसी जगह है कि आप बहुत कम समय में बहुत सारे लोगों के साथ इंटरेक्ट कर सकते हैं। तो हम लोगों से मैन टू मैन ना मिलकर बड़ी बड़ी सोसाइटीज में कोई भी एक दिन पर्टिकुलर किसी जो वहाँ के मेंबर्स हो वो वहाँ जाएं, और एक दिन रखें जहाँ ये रोटेरियन ऑर्गन डोनेशन का प्रोग्राम किया जाए।
यस लीना जी, मैं आपको बता दूं कि जो ये वॉरियर स्कीम है, ये यही स्कीम है। Here we are reaching to everyone of your society, every society, everyone. Suppose you are staying in a society and you become the warrior, you can, whenever there is a training session, you can talk to your, put it in your group that this is a training session. You fill up the form, attend the training session free of charge. And definitely,
exactly that I am saying.
Yes, this is the work of you all. So there is no problem. I can see the hand of Rotarian Professor Dr. Lakshmi Goel. You have raised the hand earlier. Are you there or I missed you? Okay. I think.
Dr. Kamal Jain has raised the hand.
Sorry?
Dr. Kamal Jain?
Dr. Kamal Jain.
Okay, Dr. Kamal Jain. Yes, please. Please unmute. Please unmute.
Good evening, sir. We can have one session on how to raise awareness for our warriors.
Rotarian Dr. Jain, see, that is what we are doing is we are going to make a 5 sessions training program in which the thing are about the awareness. First thing is they should be aware about the organ donation, the warrior. Then we will train them, we will give them the legal and ethical aspects, etc. Then we will train them about the public speaking, about the communication, about the social media.
Now
So they can also become the brand ambassador of organ donation. The warrior, they will become. So it is a chain. It's going to be a pyramid from top to bottom. It will go increase. Yes.
Yeah. No, just now we heard our member, we can put up the banners and all. She was talking about the banners and all. So what I mean to say now, which is the most effective place where we can do this such thing is, one is where the Pratna Sabha takes place. There we have a lot of people, and especially the one who have donated the organs or eyes. In that particular Pratna Sabha, if you attend.
Kamal Jain, paucity of time is, but मैं आपको बता दूं, रोटेरियन उमा झंवर जो है हमारी इंदौर की, ये प्रार्थना सभाओं को अटेंड भी करती हैं. जो जब लास्ट प्रार्थना सभा होती है वहां ये खुद भी जाती हैं, वहां लेक्चर भी देती हैं, बताती भी हैं. लेकिन आप सोचिए कि प्रार्थना सभा में अभी 50-100 लोग आए हुए हैं, लेकिन जो वॉरियर कंसेप्ट है इसमें हम लाखों लोगों की उम्मीद कर रहे हैं. हम इसको 1000, 100, 200 की बात नहीं कर रहे. और वहां भी उसमें भी
can be one of the thing.
Yes, जैसे आप हैं, उमा झंवर जी हैं, और there are so many. They all are going to speak. We are going to record. We will make PPTs, etc. I know that is also some expense, but that our members are capable. Some good hearted person will definitely donate in that.
Sir, I will like to share one good news today. Today at 7 o'clock, I had my lecture presentation in one of the conferences of Giants.
Yeah.
And after the conference, I got 7 to 8 lectures appointments.
Very good. So yeah. this is what
at different places.
Yeah. Thank you very much.
They have already finalized the date also.
Yeah. Thank you very much, Rotarian Dr. Kamal Jain. And over to you, Inspire Secretary.
Thank you so much, Rotarian Lal Goyal, Founder and Charter President, for giving so much of information. Of course, we all have a lot of questions, and we all have taken on record the suggestions of whoever has spoken today very well, and will incorporate in the organ donation warrior campaign also. And thank you so much for giving so much information. Over to you, President.
Thank you very much, everyone. On behalf, I would like to extend my vote of thanks in today's meeting, and I express my deepest gratitude to each and everyone who came out with wonderful suggestions and about making and training warriors in every aspect of our life, so that the word of organ donation goes far and wide. And this will be very, very instrumental in actually fast forwarding the work that this cause should be doing. Instead of just 80 of us doing, it will be the entire, the entire community will be our support. So thank you very much, everyone, for attending. And thank you very much to our Charter President, Rotarian Lal Goyal, for this excellent initiative and talk today. I would now like to adjourn the meeting. So thank you very much. Good night.